is going to present MyCupMarche, the good practice of market region. Hello, Roberta. So please present yourself and present your good practice of market region.
Good afternoon. It is a pleasure to be here today. I am Roberta Papa and I work as a researcher at the Regional Agency of Market Region, and I'm going to present you MyCupMarche. MyCupMarche is a multi-channel system developed to optimize the management of the Regional Centralized Appointment Center, CUP, and reduce waiting lists. Citizens can interact with the system via automatic telephone recall, an app, a SMS, a chat line, and social network. The system can be accessed from a PC, tablet, and smartphone. The aim is to guarantee constant multi-channel and transversal interaction, which can accompany the person to the various points of contact with the healthcare system. The target area is all residents of the market region, that is about 1,500,000 people. The system works through 4 healthcare companies. Initially, the system made it possible for citizens to confirm or cancel the appointment booked by means of an automatic telephone reminder. Subsequently, through a dedicated app, other functions were implemented, such as book and cancel an appointment for about 200 tests and specialist medical examinations monitored nationwide in regards to waiting lists, ask to be contacted by the CUP, pay for healthcare tickets, have all the details of your appointment, such as the date, the time, and any specific warning, and create specific reminder. In order to make an appointment, the person needs to access the system through strong credentials, while for cancellation and payment, no confidential access is required. The app also includes the possibility to control the use of standing vouchers for celiacs.
Okay. How long did it take to implement the health practice?
The project started in 2017 and took about 2 years to complete. The system is constantly evolving, and we are planning to implement some additional services in conjunction with the launch of the renewed regional CAP soon. The system has seen further expansion during the COVID-19 pandemic with the additions of some specific functions.
What are the key steps that have been taken?
The development process began following a specific request from the president of the region, such as the identification of a tool to address the management of the waiting list. Then we have the idea of developing a multi-channel platform to support the regional CAP. The project was carried out within the framework of an existing contract with a private company in order to manage the regional CUP software. This contract was then expanded with the takeover of another private company who analyzed the existing activities of the CUP to develop the additional functionalities to support both operators and citizens. The system exploited for some components solutions already tested and implemented, which were integrated with the regional infrastructure.
What are the strengths and the weaknesses of the implementation process and of the solution?
So the main strength is the strong commitment of political decision makers. But of course, we can also acknowledge the presence of a single regional CAP, its integration with other regional applications, the direct contact of the health system with the citizens, reduction of waiting lists, and the perspective of development towards other dimensions, such as the of the production processes of health services. As regards weak points, I can acknowledge some technological choices made during the integration phase with the other system in place, which will probably require a subsequent review. And also the need, according to the regulation, to adopt a strong authentication credential to access the system, which will inhibit the widespread diffusion. And finally, the limited access to training and user training material and limited institutional communication about the system towards citizens.
Perfect. And for what are stakeholders? Which stakeholders need to be involved for good practice to work?
Yes, all actors directly or indirectly involved in the good practice, such as regional and other health authorities, patients associations, and city committees.
Okay, and which are the weaknesses and the strengths of the best practice itself? Did you encounter any obstacles? And what are the success factors of this good practice?
Yes, among the technical obstacles, they are linked to the integration of the platform with existing systems, which have nevertheless been overcome. And as regards the success factors, the main one is the strong political support and subsequently the chain of responsibility and trust to the single entities of the health system. And another important element was the shared need to solve a priority problem at regional level, namely the waiting list.
And what were the main results of implementing the mHealth solution and the lesson learned?
Yes, the app has been downloaded by over 10,000 citizens of the market region, whereas with regard to the recall and SMS services in 2019, approximately 67,000 visits were reassigned and approximately 145,000 reminders sent via SMS, contributing to the reduction in waiting lists. The advantage for citizens was also that they could feel the health system closer and benefit from a personalized reminder on where, at what time, and what they should do, for example, fasting, before coming to the appointment. As regards the economic return, it was extremely significant, estimated at over 1 million euros in 1 year, considering the healthcare activities reassigned instead of citizens simply missing an appointment, and the savings obtained from activities carried out by the system instead of the operator, such as the telephone calls. So as regards the lesson learned from a technical point of view, the development of new apps rather than the use of existing fixed components would have made the project easier to implement. And another lesson learned concerned the importance of linking the project to the real needs of the systems, not only as a success factor, but also as an element of sustainability.
And what is the status of the good practice? Is it the practice ongoing?
Yes, MyCupMarche is fully operational and regularly updated with the introduction of additional services.
Okay, and so what are the future plans to take advantage of the mHealth solution?
Yes, in the near future, in relation to the start of the new regional tab, features such as the possibility to move the appointment and to be notified when the results are ready, both for the citizens and for their minor or elderly family member, will be implemented. The creation of a community is also planned, where citizens, by registering on the app, can receive information on health services, last-minute booking proposals previous to their planned booking every time another patient cancels an appointment, and also an appointment exchange service between those registered in the community. With a view to accompanying the patients on their healthcare path, the app will guide the patients inside the facility to the right floor and room, informing the healthcare staff, for example, of the number of people queuing. Functionality offers also further possible developments, such as communication with the patients and, for healthcare staff, the possibility of analyzing work and care processes. Moreover, work is also underway to extend the system to the management of screening and vaccination campaigns, with the possibility of inviting citizens to carry out screening, ask for information, postpone appointment, view vaccination booklets, find out about experienced vaccination, and book, cancel, or confirm appointments. It allows to considerably reduce the workload for the staff who currently manages campaigns by sending individual letters.
And according the period we are living, has the good practice been developed during COVID-19? If so, how was it used?
Yes, MyCupMarche has proved valuable in the management of COVID-19 pandemic. It has been integrated with the management software dedicated to monitoring quarantine patients and has ensured through the automatic recall and SMS system a daily contact with thousands of them to follow the onset of symptoms in order to alert the general practitioner and the prevention department. The system also supports a series of activities linked to contact tracing. And finally, the system has been used to warn clients of the change of their booking due to the emergency. As a result, the system contacted over 250,000 people for the services.
And finally, do you have any general remarks to underline on this best practice?
Yes, I would like to acknowledge the fact that this process has given a decisive boost to the creation of a data warehouse dedicated to monitoring CAP waiting list, also accessible to citizens. And it also allows data analysis and the development of dashboards dedicated to COVID-19 data.
And thanks. Thank you, Roberta. Bye.
Thank you. Bye-bye.